And it's my pleasure to be in Milan today to speak to you about behavior analysis, autism, and public policy. I come to you today in several different capacities, really 4 capacities. One, as Professor Moderato mentioned, is as Vice President of Autism Speaks. And I hope you're familiar with Autism Speaks. We focus on scientific research into cause and cure for autism. We promote awareness of autism. We serve the families who are currently grappling with autism. And then the 4th pillar of our mission is the one that I had, and that is advocating for public policy changes to help people who need services for autism. That's my full-time job, is working for Autism Speaks in the advocacy department. On the side, my husband and I also founded an ABA center for children with autism in our home state of South Carolina, the Autism Academy of South Carolina. We started this program only about 3.5 years ago, and it has given me a new perspective on the advocacy work that I do, because now I understand it a little bit more from the business end of things. So the Autism Academy of South Carolina is a year-round applied behavior analysis program serving children with autism from ages 2 through 21. The 3rd capacity in which I come to you is as a professor. I used to teach law school full-time before I began working with Autism Speaks. Now I teach on the side. I'm an adjunct professor at George Washington University Law School, and I teach the only class on autism and the law. And it's been very gratifying to be able to influence the lawyers of tomorrow to help them understand the needs of individuals with autism. They tend to be educated on the other side of things in the United States, the insurance company, the big institutions, but they're not so much educated on the needs of families. So my class teaches the legal aspects that surround autism from the family or the individual perspective. And my husband and I also wrote a textbook by the same name, Autism and the Law, which is a comprehensive look at all of the laws surrounding autism. But the 4th and most important capacity in which I come to you is as a parent. My firstborn son, Ryan, has autism, and he's on the severe end of the spectrum. And that certainly is what has influenced me most to advocate in the field of autism and applied behavior analysis. Ryan was diagnosed with autism at 22 months of age. And we were very fortunate. We were living in Washington, D.C. at the time, which was good because we had access to some very fine medical institutions. He actually received diagnoses from 3 different medical institutions: Johns Hopkins University, Georgetown, Children's National Medical Center. And looking back, that was really fortunate that we had access to these really good institutions and that we had diagnoses from all 3 of them, because they all recommended the same course of treatment for our son. All 3 of these institutions said, you need to get him into an intensive intervention program based on applied behavior analysis right away. I didn't know what applied behavior analysis was at the time. I'd never heard of ABA. I barely knew what autism was. But I did my research, and I learned that the way it's applied in autism is it's utilized as a one-on-one therapy delivered up to 40 hours per week, depending on the severity of the child. And I researched to understand how it works and why it works. And then I learned that the way it's typically delivered is in a multi-tiered system with a board-certified behavior analyst at the helm who assesses and designs the program, and then maybe a mid-level provider or therapist, and lower-level behavior technicians or line therapists who are actually working with your child in a home or in a clinic for up to 40 hours per week. That level of intensity, of course, makes it quite expensive for a typical family with autism. For me, the cost in American dollars of an intensive ABA therapy program were going to equal about $71,000 per year. I remember thinking, wow, thank goodness we have health insurance. In America, not everyone has health insurance. Of course, it's a different system for what you have here, but we were working and lucky and fortunate that we'd had health insurance. Little did I know that health insurance would not pay for 1 penny of the applied behavior analysis program that my child's doctors had prescribed for him. Not 1 penny. Why not? I wondered the same thing. So I started filing claims and trying to understand, if my child's doctor prescribed this, why is it that you will not pay for it? And I got different answers different times from the insurance companies that provided our health insurance. Sometimes they would say, well, that ABA treatment that you want, that's experimental or investigational. And I thought, really? I don't think so. The United States Surgeon General, way back in 1999, had said 30 years of research demonstrates the efficacy of applied behavioral methods in reducing inappropriate behavior and increasing communication, learning, and appropriate social behavior. Our Centers for Medicaid and Medicare Studies had endorsed ABA. The National Institute of Mental Health had endorsed ABA. It seemed completely inappropriate to me that a health insurance company should be able to deny coverage by telling me that this treatment is experimental, when at the highest levels of government and throughout the scientific literature, ABA had been proven effective for individuals with autism. Sometimes they would say, well, we can't pay for that treatment because you're not using a licensed provider to provide it. Well, this also struck me as bogus because at the time, there was no such thing as a license for behavior analyst. Of course, there's the national board certification, but states did not have licenses for behavior analysts, which the insurance companies were insisting on. So that also did not seem fair. Sometimes they would say, well, the treatment that you want, this applied behavior analysis, is really educational in nature. It's not health care. This also struck me wrong because, first of all, I knew that the schools in the United States, at least where I lived, were not providing quality, intensive ABA for children with autism. Even if they wanted to, frankly, they didn't have proper resources. They didn't have the money to provide one-on-one or small ratio intervention. So it was a fallacy to just tell me this is educational so I can get it from the schools. But more importantly, it seemed philosophically inappropriate to me, since it was a doctor, after all, who diagnosed my child with autism. It wasn't a school principal or a teacher. It was a doctor who said your child has autism and needs applied behavior analysis. Notwithstanding all of these reasons for denial that I thought were inappropriate, I realized that we were the lucky ones. My husband and I are both lawyers. We had good jobs and good educations. We were able to make enough money that we could privately pay to get ABA intervention for our son. But it broke my heart, frankly, thinking about the families whose children were diagnosed with autism, whose doctors told them to get applied behavior analysis for their child if they wanted the child to have any shot at a functional life, and yet there was nothing they could do to afford that kind of intervention. Families are willing to make sacrifices, but if you don't have the money to sacrifice, what are you supposed to do? We, even as a double lawyer, two-income family, we had to make sacrifices. We sold our house and moved to a less expensive house so that we could afford ABA therapy for our son, and we were glad to do that. But not all families have a house to sell or a second salary to sacrifice. What were they supposed to do? So, kind of motivated by my experience with Ryan, my own son, and inspired by the old Schoolhouse Rock. Do you guys know the cartoon in America? There was a cartoon talking about how a bill becomes a law. I'm just a bill, yeah, I'm only a bill, and I'm sitting here on Capitol Hill. Okay, a few of you know this. And it tells children this is how a bill becomes a law. And I remember watching that cartoon and thinking, gosh, anybody can write a bill, right? Anybody can write a piece of legislation and take it to their legislature and try to get them to pass it. So way back in 2005, by this point I had moved back to my home state of South Carolina. And back in 2005, I wrote a very simple bill that just said, if a health insurance company is doing business in this state, the health insurance company must pay for whatever treatment a doctor prescribes for a child who is diagnosed with autism. It has to be a mainstream evidence-based treatment, but I wanted to make sure that any child whose doctor prescribes ABA therapy for the child would be able to get coverage through their health insurance company. I was naive enough not to know how difficult it is to pass a piece of legislation. And I guess that was good, or I may not have tried it if I had known how difficult it would be. But writing that bill was the beginning of a 2-year journey that was kind of a roller coaster ride, at times a battle, a very long process, starting with having our legislative committee hear the bill in January of 2006. There were many people who opposed this little piece of legislation that I thought was such a good idea. They would say things, for instance, like, well, they would raise the same arguments that applied behavior analysis is experimental or it's educational, so the schools should cover it. Or they would say, well, we could pass this law that you've written, but still not everybody would get it. Not everybody would get coverage for ABA because not everybody has health insurance. Well, that's true. Not everybody in America has health insurance, or even those who do, not everybody has the same kind that would be regulated by the state. But that didn't seem like a good reason to me not to pass a bill to get treatment to the ones that you could reach. After all, if you were standing, this was the analogy that I thought of, if you're standing on a dock and there is a boat in the water that's sinking, and there are 10 people on that boat, you're standing on the dock with 3 life jackets. Would you toss out the 3 life jackets to save the people that you could, or would you hold on to them because you didn't have 10? Of course, you would toss out the 3 life jackets and help however many you could. That's how I looked at this bill. Even if everybody's not going to have access to care as a result of the bill, let's help the people that we can help. Sometimes they would argue, well, insurance is very costly in the United States, and our small businesses are going to go out of business if we keep adding things that health insurance must pay for. Sometimes they would say, well, I understand and I'm sympathetic to your children, but that treatment is expensive. We can't make health insurance pay for something that costs $70,000 a year. And to that I said, and Professor Moderato said the same comment in his opening remarks, no, it's too expensive not to get this treatment to our children with autism. Yes, it may cost $70,000 a year or $50,000 or $30,000 a year to see that a child gets an ABA intervention program. But Harvard put out a study in 2006 projecting that it cost $3.2 million over a lifetime for each individual with autism who doesn't get this intensive intervention and overcome their symptoms. So if you want to talk about a lot of money, take $3.2 million per child, multiply that times the current prevalence statistic of 1 in 68 children, that's a lot of money. And it's going to be too expensive for the state and the governments to care for these children for their lifetimes compared with investing in their future now. Sometimes the opposition argument would be, well, I wish the insurance industry would cover your children, but I am philosophically opposed to mandates. I shouldn't show this picture here. This is the governor of South Carolina who was not in favor of having the government tell the insurance companies what they had to cover for children with autism. We disagreed. So 2005, 2006, 2007, I worked in the South Carolina legislature to try to get this bill passed, along with many other families of children with autism. And finally, on May 25th of 2007, the legislature passed this piece of legislation. That wasn't the end of the story, because 2 weeks later, the governor of South Carolina decided to veto the bill that we had spent 2 years working to pass. He vetoed this legislation at 10:30 at night, the night before the legislative session ended, June 6th. It was devastating. But I stayed up and called all of the autism families that I could think of around the state and woke them up and said, you've got to show up at the legislature tomorrow morning. Bring your kids, drive, take the day off of work, whatever you need to do. We've got one more day. Let's show up and try to override the governor's veto of our bill. And that's what happened. On June 7th of 2007, the South Carolina legislature unanimously overrode the governor's veto, and this bill, which had become known as Ryan's Law after my son, became law on June 7th, 2007. It is not a perfect piece of legislation, but it does require that health insurers cover applied behavior analysis treatment for children with autism up to $50,000 per year of treatment. Now, this little experiment in public policy and advocacy led to a complete career change for me. I did not work for Autism Speaks at the time I wrote that bill. I was doing that just as a mom and as a volunteer because it seemed like the right thing to do. But Autism Speaks, which is based in New York, contacted me shortly thereafter and asked if I would like to come to work for them to try to replicate this law in all 50 states. And I had to think about it for a little while. I was practicing law and I enjoyed what I was doing, but I took their offer. And so for the last 6 years, that's what I've done, is travel around the United States and try to replicate Ryan's Law in other states. It's been quite an interesting journey, an interesting ride for me. That was Vermont in April. It doesn't normally snow in April. That's the CDC in Atlanta. Alaska, Utah. There was a goat right outside of the legislator's office in Utah. Georgia, Virginia. So how are we doing? I always like to start this tour in 2001 because that's the year Ryan was born, but also that's the year that the very first law requiring coverage for autism treatments, including applied behavior analysis, was passed. The bill that I worked on in South Carolina was not the first one. I didn't know it at the time, but one other state, Indiana, had passed a similar law in 2001. And this happened because a congressman's grandson was diagnosed with autism. So in 2001, there was one state that required health insurance to pay for applied behavior analysis. Here's 2002, 2003, 2004. One time I was showing this and a lady in the back said, "Excuse me, your picture is not changing." I said, "I know, that's exactly the problem. It's not changing." This is 2005, 2006, and then finally in 2007, when Ryan's Law passed in South Carolina, that started sort of a movement in the United States. Texas passed a similar law the same year. In 2008, 5 more states passed a similar law. In 2009, 7 more states for a total of 15. In 2010, 8 more states for a total of 23. In 2011, 6 more states for a total of 29. In 2012, 3 more states for a total of 32. In 2013, 2 more states for 34. And as of right now, there are 37 states that have passed laws specifically requiring health insurance to cover applied behavior analysis for children with autism. So we've made a lot of progress in the United States. Does that mean that everyone in America gets ABA? No. I wish it did. It's not that simple. First of all, there are still 13 states that haven't passed these laws, and that's still what I'm doing as I travel around from state to state to state and try to get these laws passed in those state legislatures. Secondly, even of the states that have passed this legislation, the terms vary dramatically. So you can see, let's see, it's on the next slide. In Maine, for instance, you have to be at age 6 or under to get coverage for applied behavior analysis. Terrible. We know that it's most effective for children at the youngest ages. We like to catch them when they're 2 and start intervention right away, but not everyone gets diagnosed that early. So there are still a lot of terms that need to be worked on these laws in South Carolina, and that's part in the United States. That's part of what we do at Autism Speaks as well, is go back to these states and try to improve the coverage that already exists. Also, as I mentioned, people in the United States get their health insurance from a variety of sources. So even in the states that have passed this legislation requiring coverage for ABA, not everybody has the kind of health insurance that is subject to that law. So we also work with big companies that design their own health insurance plans. We work with our federal government to try to get federal plans to include coverage for ABA. We work with our Department of Defense to try to get military plans to cover ABA. All very much an ongoing project. This is an example of just some of the companies who design their own health insurance plans who have voluntarily decided to cover applied behavior analysis. We work with these companies, we go sit down with their corporate executives and try to explain to them the merits of applied behavior analysis to treat children with autism. And again, this is just a sampling of the many, many companies who now understand and have chosen to make that investment in their employees' children. We're still working on the federal government. Some people who work for the United States government get coverage for ABA therapy, and others do not. Again, a work in progress. We also, you guys have heard of Obamacare, I assume. We're still working with our federal government to get plans through the Affordable Care Act to cover applied behavior analysis. Right now, one of the goals of the Affordable Care Act was to create consistency throughout the United States so that if people had health insurance, they all had coverage for the same things. Well, applied behavior analysis is a perfect example of how that goal was not really achieved. Right now in the United States, in 26 states, if you have health insurance through the Affordable Care Act, you have coverage for ABA. And in 24 states, you do not, if you have coverage through the Affordable Care Act. So again, that's another project we're still working on, is trying to get that coverage consistently for anyone who purchases coverage through the Affordable Care Act. Now, let's talk for a few minutes about how we are able to convince governments and corporations to add this coverage. I know that in Italy and throughout Europe, you're still working to get appropriate recognition for applied behavior analysis and to get funding for coverage for children with autism so that they can access this care at the levels they need. Here are a few things that we found worked well in America. First of all, whenever we went to speak with a lawmaker, a legislator, we told all of our families, be friendly and polite, not demanding. Too many people go to their legislator or their congressperson and they bang their fist on the desk and they say, how could you not do this? My child needs this coverage. Most of the time, these legislators don't know anything about it. And if you come in and you bang your fist at them, that makes them mad from the very beginning. Your job as a citizen is to go in and educate the legislators and start with what autism is. Start with what applied behavior analysis even is. They don't know. They don't know. So your job is to educate and make the assumption that they probably would like to help you if you could help them figure out what the right solution is. That was a key ingredient in all of our legislative campaigns. Get to know your elected officials. We had a whole series of what we called Starbucks meetings, where we would have a handful of families impacted by autism invite their local legislator to Starbucks. It was a non-threatening environment because you could have your cup of coffee and leave, and this is where we would educate our legislators and get to know them and let them get to know our families. And then it made a big difference when we asked for their vote on our bill. Pursue one thing at a time. If you go to your legislature and you have several different bills or measures that you would like them to address or to pass, let's say you have one that declares April Autism Awareness Month, and you have one that requires funding for ABA therapy for children with autism. They're probably only going to do one thing for autism, right? So which one are they going to pass? Which one are they going to pass? They're going to declare April Autism Awareness Month. That's easy, and it doesn't cost anything. So don't give them an option. Don't make it multiple choice. Give them one important thing at a time and make them choose to give funding to children with autism if they're going to do something for the autism community. Educate. I already mentioned that your job as a citizen is to educate your legislators, who, after all, really aren't expected to know everything about everything. And certainly, unless they've had a personal experience with autism or ABA, probably know little about it. But remember to educate on a surface level. The first time I ever testified on this matter, when I tried to explain what autism was, this was the slide I used. You recognize it, it's from the DSM-4. That was way too much information. They can't process all of that. And then I dumbed it down a little bit more. And finally I added colors to it and made it graphic, and then they got it. You have to educate on a very surface level. Now I go in and I say, autism is a brain disorder. It affects different people different ways. Some children can function okay but have social difficulties. Other children are completely dysfunctional and cannot communicate. That's about it. At their level of generalist, that's all they really need to know. When I try to explain what ABA is, very difficult concept to explain to someone in the abstract when you've got no one to model it. They're not really that interested, but you need to convince them that it's worthwhile. This is how I convince. I show a graphical representation of the results of the Lovaas study from 1987. I don't explain too much about why it works, but I say it works. You had one group that got ABA, you had a control group that didn't. 47% achieved normal IQ over here, 2% achieved normal IQ over there. And I follow up with one more slide, and that's this one. And I say, if you want to talk about how this impacts you and the state's obligation to care for these children, this pie chart shows where the children in the ABA group went to school, went to elementary school. The 47% who achieved normal IQ went into first grade, mainstreamed, with no support. And then the other 42% of the children who did not achieve optimal outcomes still made clinically significant progress such that they could go into a less intensive special ed program. This is what speaks to our lawmakers because it translates into money, okay? That 47%, you essentially just cut your special education budget for autism in half. And even if they're not motivated by doing what's right for the child, by helping this family overcome, they're motivated by dollars and cents. This is what I learned from you all. Use positive reinforcement with your legislators. When one of them tells you, yes, I will vote for your bill, yes, I will co-sponsor your bill, positively reinforce that good behavior. Write them a thank you note. Issue a press release. I love that. One of you told me that that's called a behavior trap. You issue a press release and say, Senator Jones has agreed to support the autism bill to pay for ABA, and you put Senator Jones's picture in the paper, and guess what? Senator Jones is then locked into supporting you because you've already publicized what a great guy he is and that he is going to support this bill. It's important to be there. I know it's difficult when you're working, and it's difficult for families who are caring for children with autism at home, but you have to be there and be present in front of the legislators to get them to act on a bill. 9 times out of 10, a bill that's filed just sits there. It doesn't get voted down, but nothing ever happens to it unless you're there pushing. And it's also important to pack the room, let them see how many people are impacted by autism. Let them see people from their own community. And I also recommend involving the media. I was afraid of the media when I first started this advocacy work because I knew I was a journalism major in college, and I knew that journalists are supposed to present both sides of the issue, equally weighted. The fact of the matter is, most journalists find this a very compelling story, and they want very much to see the children with autism get the treatment that their doctors are recommending. So even to the extent that it's supposed to be a balanced story, it usually tips in our favor. And finally, my last tip is just say no to task forces and working groups. So many times we've had a legislature or a Congress say to us, that's a really important issue. I am very concerned about individuals with autism, and I'd like to study this applied behavior analysis that you tell me about. In fact, I'd like to appoint a working group or a task force to study it so we can spend some time learning more about it and understand all the implications. No, 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 no. What that actually means is I can delay you for a year or maybe 2 by appointing a working group. It doesn't need to be studied, okay? Whenever a legislator says to me, I'd like to appoint a study group, I say, no, thank you. Tell me what it is you need to know, because I bet we already have it in the literature somewhere. So reject those overtures that seem like they're for the right reasons, but maybe are just delay tactics. So, wrapping up, are we where we need to be in the United States? Certainly not. We've come a long way in the last 10 years, but we have a long way to go. And I want to show you this message that I received on Facebook a few years ago, just to demonstrate that we still have work to do. Are you all on Facebook? Yes, many of you. You know, on Facebook, I got this friend request, and there were no friends in common, and sometimes I ignore those, but for whatever reason, I accepted this friend request, and I got this message within 5 minutes. And I read that message and burst into tears. And then I wrote back to the mom, and I said, first of all, don't sign any custody papers. I was afraid she might be in her lawyer's office right then and there, getting ready to sign over custody of her 2-year-old. I said, don't sign any papers. Please, would you write me back, give me your phone number, and tell me who your husband works for. I would like to call the president of the company and talk to them about this. And the mom did write me back, and she gave me permission to call the corporation that her husband worked for. And I did, and I called the president and I said, I'd just like you to know that there is a family in your company who has a child with autism. Actually, they were twins. She had 2-year-old twins. One had autism and one did not. And I said, I'd like you to know that there's this family with twins. One 2-year-old child has autism. and they're on the verge of giving up custody of that child just so that child can get the ABA treatment that the doctor recommended. Because your company doesn't cover it, they're having to give up custody to get that treatment. They can't pay for it privately. And I said to this company, I said, I would just like to make you aware of that, because I'm assuming that you probably didn't know, right? Give them the benefit of the doubt. I'm assuming you probably didn't know, and I wanted you to be aware of it and give you the opportunity to do the right thing. You can add this coverage, you can add an ABA benefit to your health plan, and do the right thing for this family, and you'll look like a knight in shining armor. I said, and I work for a company called Autism Speaks based in New York, and we've got a great public relations department. We can shine all kinds of positive light on you if you would like to choose to do the right thing for this family. And I said, if you would not like to choose to do the right thing, I also have friends at the Today Show, and I think they'd love this story. And guess what? The company decided to do the right thing. They added the coverage, and so this particular story has a happy ending. The company decided to pay for the ABA, the child got the ABA, the mother did not have to give up custody, and I've never met the family, but they write me still to this day, and the child is doing wonderfully. The child has made terrific progress. But I shudder to think how many families are out there still. This mother happened to look me up on Facebook and reach out to me, and I happened to accept her friend request. There are still many, many families out there whose children are diagnosed with autism, whose doctors are telling them to get applied behavior analysis therapy, and who still are not able to access it. So I thank you so much for the work that you're doing. I always, when I talk to a group of behavior analysts, like to end with a thank you, because we've benefited so much personally, my own family, my own son. Ryan, my son, is 13 now, and he's still pretty severely impacted by autism. He's essentially nonverbal, but his life is completely different now because of the ABA that he has had access to. When he was 2 or 3 or 4 years old, we could not go to a restaurant. I could not take him to the grocery store. We stopped going to church. We could not even go to church because his behavior was so disruptive. Now, I take him anywhere and everywhere. So it has changed the life of my entire family, and for that, I'm grateful to you.